So the next muscle groups we're going to kind of get into are a little bit more of kind of those which deal more with the shoulder, with the kind of the shoulder girdle or the pectoral girdle itself, where the previous video kind of covered more of the head and the neck muscles. So this first muscle here is something called the trapezius. Now the trapezius has uh, it has a number of different functions. Right, the trapezius actually extends upwards and attaches to the external occipital protuberance on the occipital bone, comes all the way down, attaches to a number of the spinous processes throughout the thoracic spine. It also extends laterally and attaches to certain parts of the scapula, like the acromion process. So the trapezius muscle can do a large number of functions in as regards to head movement, in regards to shoulder movement. Really, I mean the trapezius can extend the head, right? It can flex the head any number of ways. It can retract the scapula. It can depress the scapula. There's really the number of functions that trapezius can perform. I'm really not going to cover too many because it's because of how because of the number of different possible functions it can perform. It's best just to kind of say it can do a lot and move on, right? But one of the things we can see is how superficial the trapezius is, right? Because of the fact it's so superficial, to see anything beneath it, right? To see, for instance, some of the muscles that are eking out right here, something called the rhomboid, we've got to remove the trapezius. So you will notice in a number of the different images, even some of those to see the neck, right? For instance, splenius capitis, can't see that. Semispinalis capitis, can't see that. We can see a little bit of levator scapulae here, but the trapezius is MIA for a number of different muscles. This next muscle here, again, you can see. To see this, trapezius had to be removed. All right, and even beneath that, we had to remove a number of other muscles. This is something called erector spinae. Erector spinae. This is quite deep, but this is going to erect, right, the vertebral column. This, by and large, this is not a major muscle group, right? There's different bodies, right, of this muscle. If you look, we can see kind of one here, one here, one here. There's different muscles, iliocostalis, longissimus. There's different muscles which make up the erector spinae. Right? But really, what they're meant to do is erect the spine, right? Keep the spine in this upright motion. That's the entirety. That's the purpose of it. That's why you can see it attaches way down here at the sacrum, something called the thoracolumbar fascia. Comes all the way up and attaches to all of the number of different ribs, as well as the spinous processes and transverse processes throughout the entirety of the spine. This here, right, this is the diaphragm, right? This is our primary means of breathing, right? Right now, as you're sitting there or standing there, however you're watching this, when we just quietly breathe, right? It's the diaphragm which is causing us to inhale and to exhale, right? When the diaphragm contracts, it actually pulls downwards. It actually flattens out, right? So it goes from kind of this position here, and it flattens out, so it would be kind of in this position down here. So when that happens, right, our kind of that what people kind of always refer to as belly breathing, if you will, right? Because as the diaphragm contracts and pulls downwards, that actually forces the belly to protrude. Well, it has to, right? Think of it. Excuse me. As the diaphragm contracts and pulls downwards, that forces the viscera, right? The liver, the stomach, the intestines, they have to go somewhere, so they start to protrude outwards. And then as the diaphragm relaxes, you begin to exhale. The entire purpose of the diaphragm is to change the size of the pleural cavity, or basically the lung cavity, right? This thing here, right? This is where the lung would be. Right lung, left lung, right? That's where they live. I know respiratory system is not something we've covered. You won't cover it until next semester, right? But one of the things about any closed kind of case or any closed system, when you increase the volume of this cavity here, when you increase the volume of it, if you make more space inside of it, that's going to reduce the pressure inside of it. Right? So if we reduce the pressure inside of it, that means more air can rush in because we've reduced the pressure inside of the cavity. Eventually enough air rushes in that now the pressure inside of the cavity increases, so air can't rush in anymore. So the entire basis behind the diaphragm is to regulate the size of the thoracic cavity, specifically that of the pleural cavity, because that impacts how much oxygen or how much air we breathe in and we breathe out. Again, another example of the diaphragm here. Again, here we see, right, lung here, lung here. So the muscles of the abdominal wall, right, we can see on the right, well, excuse me, on the right, as you're looking at this on the left, right, we can see what's called the external abdominal oblique. And again, if we look at kind of the grain of the muscle, right, it goes, just draw something here, right, the grain of the muscle kind of comes through like this. Same thing on this side. Grain of the muscle comes through like this. Grain of the muscle comes through like this. So if we extend kind of these all the way through, you can kind of see how this forms a V. Right, this letter V that forms here, that's the external abdominal oblique. The internal abdominal oblique forms an inverted V. Right, for instance, if I follow the grain of this muscle like that, follow the grain of the muscle like that, you can see how it forms an inverted V. So the internal abdominal oblique forms an inverted V. Or is that going to make sense? Now, the external abdominal obliques, yes, they are more superficial than the internal abdominal obliques. Absolutely. However, on some images, for instance, if we want to get all the way down to the transverse abdominis muscles, these are very deep. Right? We had to remove these, rectus femoris, this here, we'll look at it in a second. We had to remove all of that to get to the transverse abdominis. If that was only done on one side, for instance, right, we kind of lose our ability to compare. So one of the things we can do is to look at the grain of this muscle. If we can't really tell the depth of the muscle, if I can't tell that this is the most superficial, look at the grain of the muscle. Right? If it forms this V shape, like this and like this, we know that if it's this upward side V, that this has to be the external abdominal oblique. If it's this inverted V, like this, right, so you can see them really clear right here. Oops, a daisy, sorry about that. Really clear here. If they form that inverted V, we know they have to be the internal abdominal oblique. Transverse abdominis is just that, transverse. Well, yeah, if you look at the grain of this muscle, I mean, it is just transverse or horizontal and plane. Right. The external abdominal oblique, again, these are kind of the same idea. Let's say if I were talking about the right external abdominal oblique, so this guy here. Right. That's going to cause you to essentially cause the torso. Imagine the motion of your right shoulder kind of bending down to the left towards your left hip. Right, so as you're sitting there or standing there, think about making that motion. Take your right shoulder and try and move it and kind of bend it down towards your left hip. That's the motion the external abdominal oblique on the right achieves. At the same token, that's what the left internal abdominal oblique achieves, right? Think of it. If I take this right shoulder here and I try and bend it down towards this left hip this way, the left internal oblique and the right external oblique are the muscles which actually achieve this. And the opposite is true for the left and the right here. Transverse abdominis. This really doesn't do a whole lot of kind of side bending or what's called lateral flexion. Really what this does is help to compress the abdominal cavity, right? So when we think about increasing intra-abdominal pressure, right? Or if you've ever coughed, well, if you've ever coughed or sneezed, right? But think of when you cough or sneeze, or you have a bowel movement, or you laugh, or you yell, or whatever it happens to be, those muscles throughout the abdomen which can tighten up. Right? Yes, the external abdominal oblique. Yes, the internal abdominal oblique. They help to increase intra-abdominal pressure as well. Absolutely. But when we talk about abdominal muscles, the transverse abdominis, that is the major muscle, but the primary means by which we can actually increase the intra-abdominal pressure. Right? It does a number of things. It helps protect the spine, for one. Right? This is why people, right, when we think of think of a bottle of soda, right? What's one of the ways, again, let's imagine it's closed. One of the ways you can increase the pressure inside of that is if you shake it, right? If you shake a soda bottle and then you open it, what happens? Oh, it explodes. But think about the feel. Take that soda bottle and shake it. What happens to it? It becomes immensely stiff and hard, right? Yeah, because the pressure inside of it increases. Well, that's kind of exactly what we want to happen. If we want to stabilize this, the lumbar spine, for instance, transverse abdominis can contract and it increases the intra-abdominal pressure or the pressure inside of the abdominal cavity. And when that happens, all that pressure building up helps to actually stabilize the spine. Right? This is kind of why, again, it's all about stabilizing the spine itself. This is why certain people, power lifters, lifters, movers, that sort of thing, they kind of wear those additional belts because that helps to increase the stabilization of the spine. We do have a natural kind of way to do this, and one of the ways is through these abdominal muscles. Other thing, right? This is one of the other things with pregnant women, and like constipation, for instance. Constipation, especially like second, third trimester, is a significant problem for many pregnant women. Why? Well, as Junior grows, well, let me back up. Muscles, the more you stretch a muscle, the weaker it gets. There's this kind of middle of the road sweet spot where if a muscle is extended, if a muscle is really stretched out, it's pretty weak, right? If I take let's say we take your arm or your elbow, straighten it out entirely. That biceps brachii muscle is pretty well stretched out. It's not terribly strong there. As you start to bend your elbow, so if you start to bring let's say your hand closer to your face, you start to bend the elbow or flex the elbow, right? There's that middle of the road about around 30 degrees where the muscle starts to significantly increase in its strength, right? And then as you keep bending and flexing your elbow, once it gets a little bit closer to the shoulder, it starts to get weak again, right? At both extremes, if the muscle's really stretched out or if the muscle's really shortened, it's not very strong, right? But that middle of the road, right? That's when the muscle can maximize how much force it can generate. So why the hell am I talking about pregnant women? In pregnancy, right, as Junior grows, what's happening to your abdominal, well, not your, maybe it's what happens to the abdominal muscles? Well, they just get stretched out. Well, I just said, the more a muscle gets stretched out, if it gets overly stretched, it becomes weakened. Well, one of the ways we build intra-abdominal pressure is through the contraction of the transverse abdominis muscles, as well as the oblique muscles. If they're uber stretched, if they're really stretched, they can't produce much force. Well, if they can't produce much force, that decreases how much pressure we can build inside of the abdominal cavity. One of the ways we can, defecate, for instance, is through building this intra-abdominal pressure. That's why we bear down. When we bear down, the muscles can't correspondingly contract or really contract very, with any appreciable strength, that's where constipation can ensue. And there's a number of things, even when we cough, for instance, right? Even pregnant women are like, even coughing is kind of difficult because they just lack a lot of the abdominal muscles. It's not so much that they lack the abdominal muscles, it's the fact that the muscles are in a position where they can't produce much strength. Here, this is the rectus abdominis muscle, right? The rectus abdominis. This is the almighty six-pack muscle, right? I don't know. I've heard it's existed, I've never seen one. At least, I've never seen one in the mirror anyways, but neither here nor there. But the rectus abdominis muscle. This is like, back in the day. Oh, I hate saying that. I can't believe I just said it. Damn it. In high school, I know it's been, you were in high school much sooner, much more recent than I was, but kind of doing sit-ups. Right, we always think, oh man, doing sit-ups to like strengthen my ab muscles and strengthens my rectus abdominis muscles so I can get six-pack muscles. Nope, actually doing kind of the good old-fashioned sit-ups that really does not isolate really at all the rectus abdominis muscles. That really works much more of your hip flexors, which we'll talk about a little bit later on. But this is, you can see it comes up and it comes down here and attaches to the pubic bone. Right, and it comes all the way up and actually attaches to the sternum as well as a number of the ribs. Right, all up and through here. And again, this is going to function to kind of flex the torso. Right, kind of pulls the torso downwards. Right, that's what the rectus abdominal muscle achieves. So this next muscle here we're going to look at, right, what the last few muscles. Right, we're kind of starting with the trapezius, then we looked at the diaphragm, then worked our way down into the abdominal muscles. Right, these muscles are still all attached to the torso. Right, these muscles, then these next few muscles that we're going to look at, they don't specifically move or mobilize the arm. Right, they mobilize the scapula. Now the scapula, if you remember. Right, it's probably 3 weeks ago now, at least, talking about the appendicular skeleton. Right, the scapula is that shoulder blade muscle, or that shoulder blade bone, right, or that shoulder bone that we talked about. These next few muscles, actually attach to the scapula and move the scapula itself around. This muscle here is something called the pectoralis minor muscle. Now, pectoralis, there's a muscle called pectoralis major. Right. That's kind of like the big chest muscle that we all know. That we don't see here. Right. In order to see pectoralis minor, we had to remove. Right. Pectoralis minor is huge. It comes all the way up, around, and through here. Right. In order to see pectoralis minor, we had to remove pectoralis major. And you can see pectoralis major comes up here, attaches to the coracoid process, and it comes all the way down and attaches to ribs 2, 3, 4. 2, 3, 4, 3, 4, 5, right around that region, right? Again, this is a muscle which is going to protract the scapula. So when I say protract, think about somebody who has taking your shoulder blades and kind of sticking them forward, right? Don't think of think of slumpy, horrible posture. Hey, probably think of the posture we all probably have right now, right? As our shoulders kind of slump forward, right? That's called protraction. It's the pectoralis minor muscle, which is going to cause that to happen. Okay, there we go. A little hiccup there. Here, again, further acting on the scapula, right, is something called rhomboid major and minor, or rhomboideus. Right, choice is yours, same thing. This here, rhomboid minor. I'm sorry, let's try that again. Rhomboid major. This comes up and, as we see, attaches to the spinous processes of the kind of mid to upper thoracic spine. Then it comes and attaches to the vertebral border of the scapula. Now, this is going to, imagine if you were trying to take your shoulder blades and pull them backwards, or the motion you would do if you were trying to stick your chest outwards, right? The muscles which actually kind of, again, if you do that motion, as you're sitting or standing, take your shoulders and just think about sticking your chest outwards, right? So when you do that, your shoulder blades almost kind of come together in the posterior. That's the rhomboid major, which is causing that. Rhomboid minor helps as well. Again, we can see it's a very small sliver of a muscle here. Again, same thing, much, much smaller. Now, one of the things to not get confused by, rhomboid, major, and minor. There's a few different major and minor muscles we're going to look at. The major and the minor deals with the size of the muscle, not which one's above it or below it. Right? You'll see rhomboid major is much larger, and it's below rhomboid minor, which is much, much smaller, but it's above it. This next muscle, again, further acting on the scapula. This is kind of the unsung hero of shoulder movement, right? Something called serratus anterior. This is when somebody, let's say if you think about a bodybuilder, right? Guy, girl, whoever, right? Just think about somebody who's like shredded and jacked. This is that muscle on the kind of the sides of the rib cage, which kind of almost stick out, almost like little fingers, which kind of stick out and are attached to the ribs. That is the serratus anterior. The serratus anterior, you see it wraps around the posterior side and actually attaches itself to the inferior aspect of the scapula. Again, that bottom point of the scapula, it's really what kind of anchors the scapula to the thoracic cage. Remember, this again, it's been 3 weeks, almost a month now, when we first started talking about the pectoral girdle, right? Those bones which comprise the shoulder region. The only joint, right? The only thing that actually anchors the pectoral girdle onto the torso is the SC joint, the sternoclavicular joint. And remember, that's the joint where if you look into a mirror and kind of see the little swell, that almost like that little hole in the middle of your neck, right? That's right there to the sides of that. That's the SC joint, right? That's the only joint which anchors the entire upper extremity onto the torso. It's all done, the outside of that joint, the entire shoulder girdle is held onto the torso via muscle, right? Specifically the serratus anterior, right? So this muscle is hugely important when it comes to shoulder mobilization, shoulder mechanics, basically the movement of the shoulder in its entirety. Again, the trapezius we talked about already, right? Acts on the head, acts on the shoulder, so we're not going to cover this guy again. Here's the deltoid. Now, the deltoid, we can see, actually starts to impact the movement on the humerus. And actually, from here, I'm actually going to make a separate video of just the humeral muscles.